Good morning, everyone. Welcome back for Forge Breast Cancer Survivor Center's Coffee Conversations. This morning, we actually have Dr. Triebel with us to talk about chemotherapy and the brain. She has presented an amazing presentation that she's going to give to us today. But before we get into that, we would love it if you could tell us a little bit about yourself, Dr. Triebel, and all that you are doing in the breast cancer community.
Hi, nice to meet everyone. Thanks for joining us today. My name is Kristen Triebel. I'm a board certified clinical neuropsychologist. So what that means is I'm a clinical psychologist with extra training, 2 years of training in different disorders that affect the brain. And in particular, my specialty is looking at the effects of cancer and cancer-related treatment. So I do both research and clinical work with cancer survivors or, cancer patients throughout the spectrum of their disease. I also see other conditions, but again, that's kind of my area of interest. I work at UAB in the Department of Neurology. So I guess that could give you a little bit of background. I've been here in Birmingham at UAB since 2006. So it's been a while now. So I call Alabama my home. So anyway, I'm used to more informal conversations. So I'll try I usually have people ask me questions throughout, but we'll get through this slideshow. So this talk is about looking at, the cognitive effects of cancer and cancer treatment. So I really became interested in this topic when through my clinical work, because at that time it was still a little bit controversial about this whole chemo brain thing is what, they called it. It's now called like cancer related cognitive impairment. And, some doctors didn't dismiss it. Most recognize it now, but I would have patients come in with the same types of complaints. And I still see patients with the same types of complaints about difficulty thinking or remembering or coming up with words. And, I just felt like that there needed to be a lot more research on there so that we could convince oncologists that this is something important to look at and to help cancer survivors, go through that process and function and have a better quality of life. And so that's really kind of what interested me in this. Okay. So I'm going to share my screen. Oh, well. If I am sharing, okay, let me see. Here we go. I have too many screens open apparently. Okay, can you all see? I guess nod your head if you can see it or thumbs up. Okay. I'm afraid if I make this into the slideshow view that I will lose pictures of you guys. That's what was happening before. So hopefully this is okay. Is that okay, Janenda? Okay. All right. So when we talk about cancer-related cognitive changes, what I hear a lot is just that it's difficulty for some people. Not everyone experiences this, and I'll talk about this earlier, but this isn't something often noticed or like something thought about initially, when considering treatment, or, it's something noticed a lot of times in 75% of people during the treatment. But, usually when I see people, it's like a year afterwards, and there's like 30% of people continue to notice some, mild changes, but frustrating changes in their ability to, to be kind of mentally efficient and on top of things. They might report some fogginess, some kind of forgetfulness, harder maybe to pay attention or concentrate, or at least it takes a lot of mental energy, a lot more than usual to do that, and they experience some kind of mental fatigue. Word finding difficulties, and difficulty doing more than one thing at a time, which I still am not convinced that multitasking is a real thing. We all try to do it. I don't know how successfully we do it, but anyway, so again, just to kind of describe how often, or the studies that have occurred have shown that a third of cancer survivors, even prior to their therapy, do report having cognitive changes. 70% during the course of chemotherapy, and then 30% a year post-therapy. And I want to say too, I see this in all different types of cancer, not just like breast cancer, where a lot of the research has been done, but I see it in patients with ovarian cancer, lymphoma. I mean, you name it. It seems to be pretty across the board. So in those 30%, after the treatment, of course, at the time of treatment, you're thinking about treatment, you want to live. I think what worries some people is they weren't aware of maybe the possibility of having cognitive problems, long term or after the therapy. And so that's when they see me, they're happy they've survived cancer, they went through treatment, but it's like, what's going on? Am I going crazy, or am I, or is this real? And so we're able to do assessments and help diagnose what's going on, and then provide recommendations to help them function at a higher, at a better level. So just in general, it can impact their quality of life. And these changes may be, more noticeable as it would be with anyone if, when you're trying to think if you're sleep deprived, or if you're trying to do too many things at a time, under stress or deadline pressure, those types of things. So, and this is not something that's just psychological. Anxiety and depression can play into it and make it worse. But research has shown that this is just not, it's not, I wouldn't say in your head, but that it is in your head, your brain's in your head. So it's not something that's just due to a psychological problem. Did I skip? No. Okay. So contributing factors, I just have a list of these. I don't want to take too long, so we have time for Q&A at the end. But, again, the one of the areas of my research, which I don't think I talk about later in the slide, but we have some studies ongoing looking at the effects of neuroinflammation. I'm curious about that because those 30% of people who report cognitive changes even before the therapy, that's what I want to know. And my hypothesis is that it's the tumor itself, this tumor that's in your body before causes neuroinflammatory responses that affect your brain. And then the chemotherapy, hormone therapy kind of add to that. And so we're looking at neuroimaging to show for the first time actual microglial activation, which is what happens when you have neuroinflammation in the brain, to see if this is a cause of chemotherapy. And then we're also working with other collaborators who do animal research, who have been able to prevent or reduce chemobrain in animals. So it's pretty exciting. That's going on right now. It's just an initial pilot study right now, but UAB is the only place in the country with FDA approval to look at this special PET ligand. So whatever they put in you that shines up the microglial activation. So that's the first step, is just seeing if this is the case. But other factors that can play into this is, the use of hormone therapy, menopause, age. As we age, we all experience changes as we age. And then again, fatigue, mood, any kind of mood symptoms can affect that as well, and sleep. Okay, I'm going to go through these kind of quickly, but here's some of the examples. And my dog is getting a little bit restless, but so changes in attention or in concentration are common. So just, it really kind of mimics something like a mild case of ADD, attention deficit disorder, where it's hard to, to focus on something if TV's on, or you have kids in the background and all this other stuff. That can affect your functioning at work, home, and the community. So sometimes people report having trouble staying focused reading, they used to be able to, but now they find their mind wandering, and then they have to go reread that paragraph. Maybe careless mistakes with paying bills or driving. This is common, driving, and then it's almost like they kind of zone out, think about something else, and then miss the exit on the highway. It's not that they're completely getting lost, but it's that momentary stuff. And just trouble concentrating on a task. And it seems to me it's people that are higher functioning that are most bothered by this, because they're used to being on top of things, right? And then now they're just what was that? Why did I do that? And so that's what I see. Changes in memory. A lot of people report changes in memory, but it's so common in my profession to hear people say memory changes, but that's why we have neuropsychology. We assess different domains, and oftentimes it might not be memory per se. It might be word finding problems. So that's a different part of your brain. So finding, just coming up on the spot, like in a conversation with that particular word that you want to use, and it might be on the tip of your tongue. There might be some forgetfulness, just like, misplacing your keys or phone. I have my problem myself. Or walking into a room, I know what I came here for or something. It just, again, I think the main thing I see across the board is just, it takes more mental effort to perform cognitive tasks, and people kind of find themselves mentally fatigued and may need more naps or just kind of to pace themselves more so that they can, function. So there is a high rate of anxiety and depression after the first year, which is nothing to be alarmed about. But it's something that's very treatable with, our current antidepressants and with therapy. Or again, that's kind of separate from the cancer-related issue because it can aggravate the cognitive problems, but it's not solely, those cognitive problems aren't solely due to the anxiety and depression, if that makes sense. But definitely treating the anxiety and depression can help thinking. Okay, so research interventions. So basically, I had a slide, I think I took it out, but my research is kind of 3 prongs and then kind of a 4th side area. So this is the 3rd prong, but first I already talked about looking at the mechanisms, what's causing this, chemo brain. And the 2nd prong is looking at better ways of assessing it. So our tests, like our pen and paper tests, are stuff that are very standardized, structured, but what we see is in the real life, like it's not mimicking what's happening in real life because you don't have the kids in the background, the TV going or the radio on while you're trying to drive and all that stuff. So we're working with a group at Washington State University, Maureen Schmidt or Edgecombe, looking at more like the night out task. So it's a task where you have to get ready to prepare for a night out, and we're able to better assess it and see like if there's, how many times a person has to self-check or how much time it takes them to complete the task, if they complete it in order and sequence and stuff like that. So we're working on better able, to understand it so that we can treat it. And then this is the 3rd prong, is the research intervention. So, and I would say research interventions, but some of these interventions are actually available, right now to anybody. There's, neuropsychological training, and basically that kind of goes along with the speed of processing training. And so the speed of processing training, it's available, and I'm happy to share my slides and give my contact information, my email. If anyone has any questions and wants further information, I'm happy to do that. But there is a Brain HQ program. It does cost like a little bit of money, but it is it's a scientifically valid speed of processing training. And it's shown to improve memory and speed of processing. We've shown data in breast cancer survivors. We're looking at it in other populations as well. I don't want to just, speak about one. There's other training programs like Lumosity, you guys might have heard of. They just have less scientific support than the Posit Science Brain HQ program. Oh, I just did that. Let me go back. Okay. I highly recommend stuff too, just like meditation, yoga, mindfulness, like just stress reduction. That helps a lot with just kind of focusing the thoughts and being able to kind of eliminate more of that distractions, the internal distractions that people experience that can exacerbate thinking problems. And practical tips, what you can do. This is so true. I hope I have on the next slide that actually doing exercise itself. So exercise your brain, very good, use it or lose it. That's true for all of us as we age. The best things you can do for like mental exercises are learning new things, because we've shown that it actually, you're able to create new synaptic connections in your brain, and which is very important for cognition. And so if you learn new things, and that's the key, novel activities, not necessarily I mean, crossword puzzles, okay, that's fine. But like if you do something really out of kind of what you're used to, it creates these new connections in your brain to help provide your brain protection from, changes, from bad changes. So like learning a new language or taking a dance class, which is great for more than just mental exercise, but also for physical exercise, listening to music, learning how to play. I don't have this on there, but like learning how to play a musical instrument you've never learned to play. Those types of things are good for your brain. This is so critical. Keep expectations reasonable. So many of us have such a high bar set for ourselves, like that when you experience something like that, it causes a lot of frustration, and that feeds into kind of a negative spiral of like, getting frustrated, anxious, and you have more problems than that. So it sounds weird, but I always tell patients to keep their expectations in check, to like, kind of lower the bar a little bit, because they probably had too high of a bar to begin with. But it's important to let your brain time to recover. It's important to take breaks in between kind of mentally demanding tasks, to allow your body, your brain to recover. And that's healthy. Other things you can do, you can keep a journal. Taking notes in general is very helpful. I kind of talked about pacing. So just being mindful of the fact that your brain is healing and your body's healing too. And, kind of just pacing yourself so that you can actually maybe even schedule in certain times in your day where you have time to relax, to meditate, or to take a nap. And then, sorry, I'm going to cough. Consider, there are resources available, counseling to help just kind of with that transition, because a lot of cancer patients also report to me experiencing kind of like kind of post-traumatic, it's not PTSD, but like a lot of anxiety about, possible recurrence of the cancer or how they're going to go forward. And there are resources available, I know, at UAB and outside in the community to help with that. Exercise your body. There you go. Thank you. I'm glad I put that in there. Okay. So, exercise is about good for everything. As long as you don't have any medical, reasons why you can't like exercise, even walking. So it increases blood flow to your brain, oxygen, reduces fatigue. It helps your mood. It helps you think. It's one of the best things that you can do. We do have research supporting that as well, tons of it. So, okay, so eat right. Well, I'm not prescribing any medications because I'm not an MD. I'm a neuropsychologist, but some of the supplements that are good for memory are D3, vitamin B12. You can have those checked by your doctor to make sure your levels are, appropriate, or if you need to increase or supplement, having omega-3 fatty acids, antioxidants. So, the fish pills, calcium and magnesium, that also is good for impulse, like brain impulse controls, like the electrical control in your brain. And big tip, what's good for your heart is good for your brain. So all the stuff we know about kind of the Mediterranean diet, eating healthy, lean protein, omega food with lots of omega-3, like salmon, avoid the stuff, a lot loved down here, fried chicken and, sugary stuff and trans fat. Those stuff are not as healthy for our brain, but nutrients are very important. I mean, that's what keeps your brain and your body functioning. Okay, I think I already talked about most of this. So meditate, relax, nap. There, you could do deep breathing. There's a lot of free apps. If you have like a smartphone or a computer, you can download that will guide you through it. Like I'm thinking, I have a couple of them on my phone, like Calm is one. It's free. And they have different things where I listen to it to help me take a nap. Like they have like rain sounds and like different nature sounds, or they have guided imagery or relaxation where people will come on. There's even one with Matthew McConaughey on there that he's like slowly guiding you to a peaceful sleeping kind of state. So I recommend that. Socializing. So when you're out with people, which is different now with COVID, right? Hopefully we're getting out more, in a healthy way, but, having that social interaction is key for mood and thinking, and then just having a sense of humor. So being able to just laugh, be like, oh, brain fog or brain, I guess when I was a kid, they called it brain fart, but whatever, have brain moment or whatever. And, people are more understanding than you think. And there's also support groups that are available as well. I don't have this on my slide, but I definitely highly recommend, taking COVID seriously with all those precautions, because a lot of people who have survived cancer, or have cancer or undergoing treatment, are at, higher risk for having problems, and it can affect your thinking ability, we're finding. So just, be careful with that, but don't isolate yourself, find ways to still connect with others. All right, get some sleep. Okay. That's kind of a no-brainer. Sleep is helpful. And there's also, this isn't like, again, I'm not prescribing or telling you to do this, but you can talk to your doctor about medications that are commonly used for attention deficit disorder. About half of my patients that have tried them, find them helpful. So I just always ask them, and they try it, and they're like, wow, I can focus better, I can do this better. So it's it's something to consider. Okay, time pressure management. I said, I'll share these slides so you can read them later, because this is a lot of information. But basically it's learning how to manage your time better, how to structure your tasks, get a daily routine. The more structure and routine you have, the better you're able to function. Learning when your peak points of the day, and for a lot of people that might be in the morning, rather than later in the afternoon when you're kind of fatigued because you've already been working. And then, keep a calendar. Make sure to, if you keep a calendar, make sure to try to get in a routine of checking it at least twice a day, in the morning or the night before, and then, check it a couple times a day. Being able to prioritize tasks, what's really necessary to complete, or what can be delegated to someone else, or can just, is not really necessary. That way you can kind of take that pressure off yourself. Okay, and I think the rest of it we can read over the slides. Oh, click that title. Okay. I think, okay, sorry, I'm skipping through that one. Janetta, we might want to take that one out, but yeah. So I think the rest of the stuff basically that we have, that I would have in here, is we have a lot of technology that I have found personally helpful. Because I always say my cell phone is my greatest enemy, because I lose it so often. I lost it so often, it became a point of where my friend told me I needed to check out some optional things to help me find my phone. So I have an Apple iPhone. I've got an iPhone watch, which you can buy different devices. So if I do lose my phone in my house or wherever, it falls out of my pocket at work, on the way into work or whatever, I can use this little thing that will ring my cell phone. Okay. And I can go onto my computer and I can find my phone and locate that. And then I went as far as to, well, sometimes, you don't have access to a computer, or, I don't know. There's other technology. So I had a backup system. I had a harness on. This is when I was back in person at work, but there's these little phone harnesses you can put on your neck. And then I had these little tile things. I don't know if you guys have all seen them, but I have them. Hang on here. There's these little tiles or little stick-on things that you can put on your. Of course, I don't have. Oh, I do. I do use a lot of these strategies myself. So I do have personal experience with this, but okay. So for example, for me, I like to lose my keys too. So I have attached one of these fancy they're cheap, they're little tiles, and you can hook them onto your keys, which I've also hooked onto my wallet just so that they're all there. And you can use your iPhone or your watch or even a computer if you lose it to have your tile ring so that you can find, and it will also locate it. So like if you lose it in a field or something like that, you can go and actually pinpoint it and will direct you towards it. So I found those things very helpful. They've actually saved me a lot of anxiety and stress. So just leaving messages for yourself. Sticky notes are great. However, sometimes it's problematic if you have too many sticky notes, because then you lose the sticky notes or maybe don't look at them. But I recommend, like, I personally will put stuff like, because I use my garage a lot to go out, so, or the front door, I'll put a sticky note if there's something important I need to remember on that door, on their fridge, or something like that, so I'll see it when I'm getting ready to go. Using your alarms on cell phones, having, just even telling someone, hey, help me remember this. That will, just even the act of saying that sometimes will help trigger that memory later on. Put everything in the same place. That's sometimes hard, but if you can get in the habit of it, that's helpful. And I already talked about technology and then pacing yourself. So there are, for those of you who are working, there are employer accommodations that can be made if you're working. And so you could talk to your HR about, or your boss about, what types of accommodations are available for you. And then just kind of when you're, again, when you're coming off a treatment, slowly easing back into it is really critical. You don't want to overdo it. Okay, I already talked about this. So I think, yeah, that concludes my slide. That's I should have put my email in there. Let me see if I can do that right now. Well, nope, I can't do it right now. So, but I will, Janina, be happy to share my information, and that's my work number, but I do use my cell phone number for work now at home. Just to share a personal kind of story with you all. I was in a car accident in July, and I experienced a pretty severe concussion, had a seizure, all kinds of fun stuff. So a lot of these things that I'm telling you are things that I found overlap a lot with chemo brain or cancer-related cognitive impairment. And it was kind of eye-opening for me to go through that, like these things of pacing yourself, taking time for naps, like reducing expectations and trying to prioritize what's really important, using devices like that. So I can say that, having gone through that, and I did find it very similar, like the mental efficiency, how hard, if I have like 3 hours of work, I have to take a little nap, or I'll just be kind of toast for a while. So learning that stuff is good. And it's interesting being a neuropsychologist, having gone through that. But I'd like to open it up for any questions you guys have that I could help with. If you can remember in the questions from all the slides I showed. I hope this was helpful. And